Hi everyone, this is Caitlin Thompson from Medicine Frog Kambo. I just wanted to address a question and a very common thing that I see in ceremonies, and that is regarding when you see blood in somebody's purge. Now, this can be very scary when you first encounter it as a practitioner, because obviously there's a whole bunch of things that it could mean when somebody is vomiting blood. And there are some circumstances when that is deeply concerning, and there is the possibility that a catastrophic health event has happened that needs to be addressed very promptly. However, most of the time, what's very common is we'll actually see a small amount of blood in the purge, and it's usually not an issue. It's good to monitor it and to watch and see how the presence of the blood can progress throughout the purging process, but oftentimes it resolves itself without any additional concern or need to do anything about it. However, it's always good to monitor the client regardless of how much blood or what color of blood or the nature, even if it seems like they probably just had a very mild amount. So what causes this? Well, in most of the cases, it's often the mechanical pressure of vomiting and having all this smooth muscle contraction, etc., can cause a small rupture or tear in a capillary, and then there can be a minor amount of bleeding. Usually when that's the case, the purge is a little bit pink, but there's not a lot of thick or bright blood. It's just like a little bit of pinkness that you'll see, and that's not very concerning for me. Something to look at, something to keep monitoring, but if you see a little bit of pink, usually it'll subside and not escalate. Sometimes you'll see a darker color blood, and that can indicate that this blood is old, it's dried, it's been oxidized, and sometimes that can be because somebody has some sort of ulcer or sore in their stomach, or some sort of gastrointestinal inflammatory thing like diverticulitis, for example. And if the blood is old, then it means that that blood was there pre-existing to the Kambo, and now it's just being revealed because the Kambo is causing the purging, and therefore now you can see this blood coming up. But it doesn't mean that the Kambo necessarily caused the blood to happen. But again, it's something to be mindful of. If you start to see that the blood coming out is actually a bright red, fresh blood, then this is something we definitely need to monitor. So if somebody is vomiting profuse amounts of blood, or the amount or the brightness of the blood is increasing, this is concerning, because this could either be a rupture of some sort of vein, it could indicate tearing of esophageal or stomach tissue, which is a potentially life-threatening event that needs to be dealt with immediately, and that person needs life-saving surgery, or some sort of rupture of some sort. So if the blood does not subside on its own, and if there is other type of symptoms accompanied with this blood, for example, an inability to purge or swelling of the throat, and I don't mean like the normal Kambo swelling, but like significant swelling, or chest pain, sharp abdominal pain, if there's a pain that's kind of moving up and down the body, or sepsis or shock symptoms, something like that, trouble swallowing, like I said, trouble purging, even though the person's nauseous and wants to purge. These can all be signs of esophageal rupture, which, coupled with a significant amount of blood, is very concerning and is an emergency situation that somebody needs to go and seek medical attention immediately. So most of the time, that's not the case though. There's just a little bit of pink, and it's really not too much to be concerned about. If you do see blood in your client's purge, then follow up with them. Tell them to monitor both their stools and any sensations in their body. If they experience sharp pains, or if they're seeing a lot of blood in their stool, or like dark brown, oxidized blood in their stool, I would advise them to go to a clinic and get checked out to make sure that they don't have abdominal bleeding, because that can be for a number of reasons and can be an issue. I've also heard of people having hernias after Kambo and having some bleeding there, where they did get checked out, and it seemed to be unrelated to the Kambo, but perhaps the stress of, again, the muscle contraction could potentially aggravate a pre-existing condition like a hernia. So I hope that puts your mind at ease a little bit and also empowers you to recognize some of the symptoms of a more serious medical emergency where responsiveness is key. So thanks for tuning in. I hope this was helpful, and I look forward to connecting again soon.